Hi everyone, welcome to the first of the Balanced Health Check webinar series. I'm Simone Shannon, Health Advisor with the Trusted Advisor Network.
And I'm Leticia Bowden, and I'm the owner of My Web Advantage, a website design company based here in Erina.
So today we're going to dive into why such a strong digital presence is a must for health clinics. So Leticia, let's kick things off. What do you think are the two most important aspects of the digital landscape as it relates to health?
Sure. So there's two fundamentals I think we need to really get right and to keep in mind as we go through this. And the first one is the digital footprint is actually part of the patient journey. So it's something that you can't actually select to opt in or out. It's here and we need to embrace it. And the second thing is that the advancements in the digital landscape has really just shrunk the world for everyone. So what used to be a really localized service like health can now actually capture a much larger area. So that means that you no longer have to be looking for the immediate people in the vicinity of where you are just because they can't travel. Now there's a much bigger area to go to.
Great. So can you go into further detail on how the digital footprint is part of that patient journey for us?
Yeah, I think for this one, it might be much easier if you can start us off by walking me through what the patient journey looks like for a clinician. So from the moment that they meet someone who walks through a hospital door, what does that look like?
Okay, so let's take an orthopedic surgeon as an easy example. So as a patient, I come into ED with a broken arm and I need surgery. So the consultant of the day is my doctor. So I meet the orthopedic surgeon, or more than likely one of his team, that evening to discuss my ongoing care. I have four options moving forward. First, I can have an operation at the public hospital. As a public patient, probably need to wait for the trauma list. The second, I can have an operation at the public as a private patient. Maybe this surgeon or another, I can choose. Okay. Go to a private hospital and be treated by this surgeon, or find a different surgeon to operate at a private hospital.
Okay, cool. All right. So if you think of that hospital as the physical equivalent to social media, by social media, I mean Facebook, Instagram, LinkedIn, whatever the platform is there. And that is really the marketing space. So it's a bit like a marketing tool. Essentially, you're telling people about you and your services. So I think of this as a spray attack. So you reach a lot of people, but you don't get to choose who is hearing your message. They're just there. They're a captured audience. So what you currently do as a clinician without realizing it is at that stage, you start to sell yourself. So your bedside manners and the way that you make people feel, the way you follow up, that will make a really lasting impression on everyone that you touch. So that's great for you, because the more people talk positively about you, the more GPs and clinicians will think about you as a referral when they have someone that needs care. So on the digital front, once that social media, so what we're talking about, that hospital equivalent has captured those potential patients, it's not reasonable to think that every single one of them will talk to you or meet you. And so that's where a website comes in really handy. That's the first level of sales. That represents your physical self and your bedside manners and everything that we talked about before. And it confirms that you're the right person for them, or not, as the case may be. So for example, a good website for an orthopedic surgeon will say something like, I specialize in knees and hips. So that doesn't mean that surgeon can't treat your arm, because they just did. But if someone needs a hip replacement, then that will be the go-to specialist because they've seen that on the website.
So it's pretty unlikely I'll break an arm and then need a hip replacement in the next couple of years. Hopefully not. How does that help the surgeon get a lot more patients and not just me?
Yeah, so the second aspect of the website is for that initial patient to be able to confidently say to someone, oh, hey, you need a knee or a hip replacement. Have a chat to Dr. X because he fixed my arm and he was amazing. But I know that he specializes in knees and hips because you probably went home and checked out his website. So then you've got that confidence to actually give that referral to someone. And remember that the GPs and the physios will be the first ones to ask how it all went when you go and, you know, get that follow-up. They'll ask if you were happy with the results and the care that you were provided with. So you can kind of see now that the network is really expanding, not just in the physical sense, but it's expanding in the digital space as well. So the more positive feedback that you get, the more backup it will be backed up by the positive feel from your website, and the more you'll be front of mind when they're looking for those referrals.
That sounds great. I think you put a little visual for us to have a little look at. Do you think we can share that for everyone to have a quick look?
Certainly. Here we go, just by magic. Something that I prepared earlier. So you really have those two aspects. You have that marketing, which is creating awareness, public hospital versus social media and search engines, and then the conversions and really talking through people. And so that will be yourself and your network in the physical sense, and the website in the digital space.
So I love this. So to recap, the customer awareness that comes through the hospital is likened to social media, Facebook, Instagram, LinkedIn, and then you convert them into a referrer through your bedside manner or your website.
Exactly.
So we've covered the first fundamental by understanding the health digital footprint. So let's move on to the second fundamental, the advancements in the digital landscape. You mentioned the world has shrunk, but the service area has grown. Can you elaborate more on this?
Yeah, so we know that the world is a smaller place because of digital. So we have more news coverage. You know, it's cheaper to do anything and to move about and to fly. And from a health point of view, patients have the option to choose a provider regardless of the location. So we've all heard the stories of people going overseas for treatment. So the flip side of the fact that the world has shrunk and more providers are around is that as a clinician, you're no longer bound by those local catchment areas either. And I guess that has a double-edged sword, because it's time that we need to look over our shoulders really to make sure that no one is infiltrating the Central Coast, because it is easy for our patients, our local patients, to look a little bit further.
Yeah, I can actually see that. So, I mean, there's been such a lot of government support and investment on the coast, and we've got access to some brilliant clinicians in our local area. However, we need to build their awareness. So people don't travel to Sydney or Newcastle when they need to be treated locally. Better for them, their family, and the health network. So how does that digital presence help us address this?
So strong digital presence is crucial for any business, really. So it's an extension of the physical building or the person. So in my experience, industries like childcare and health have typically been reluctant to enter this space. So those who have embraced it are really gaining a huge advantage, because they're building trust. And it's not just building trust with those immediate patients, but it's also the search engines. And trust, whether you're talking physical or digital, it's something that needs time, and you need time to build the trust. There's no quick fix. So, yeah, I don't know. Do you think that it's a fair representation? What I'm seeing is fair of the health industry?
Yeah, I listen, I think absolutely. And there's two reasons for this. The first one, it wasn't actually needed. And that was because, as mentioned before, healthcare was really local and originally a really high referral-based line of work. So patients trusted what they were told by their healthcare provider, their healthcare professional, the GP, and they didn't question it. They just went. So therefore, digital wasn't part of this and wasn't important. The other reason is they don't want more patients. Our books are closed, and therefore having a website means more patients, right? So things are changing, and patients are taking responsibility into their own hands and making their own decisions. So with the quality and the range of specialists on the coast, we have to, and we shouldn't be driving to Sydney. We should be staying here. However, to keep patients on the Central Coast, they need to know what is available and their credentials so they can make informed decisions. And so remember, there are a lot of new people from Sydney on the coast, including myself.
Yeah, and like everything else, it has to be done correctly. So, Yeah, to your point before, having a website is one thing, but the messaging that you have on the website will really make a difference. So the surgeon looking very young and graduating earlier, to you and me, that might be, oh, he must be really smart. But really, to someone needing a hip replacement, the first thing that will pop into their head is, well, this is a kid. I really need someone with a lot more experience. So in the same way, a website in the health space should equally talk to your peers. It should be more than just about getting new patient. It's about getting the right patients, and it's about getting the right staff and talent. So we do hear a lot of health professionals are reluctant to get a new website or to invest in something that's decent because they're worried that it will get them into trouble. So is there more to that story than just the new patient thing?
Oh, yeah, absolutely. I think a lot of reluctance comes from misinformation and lack of understanding about the opportunities that the digital landscape creates. So, I mean, one classic example of misinformation is around the ACCC guidelines and the extra element of the APRA being the statutory regulator.
I love those guidelines. They're so open to interpretation, aren't they? It's just
Exactly. And the go-to answer then is can't say anything on a website.
Yeah.
But I think the thing is, by understanding the reason behind the guidelines, it's easier to understand that, and what you can do and what can't be done is really important.
Yeah. So is it right to say, you can't say, hey, look at me, I'm better than the rest, obviously. But can you say something along the lines of, hey, we've got comfy chairs. So in the unlikely event that you do have to wait, you'll do so in comfort.
Absolutely. As long as they are comfy chairs, by the way. If they're the old school chairs, no, because they're not comfortable. It's about being factual. So state the facts, backed by science if it's something to do with medical, and what service you provide, how you provide it, and in what environment. That's all. No fancy, we have the greatest, the biggest, the best, or we will cure this or that. That's when you get into trouble with any business. But we have the added element, we have to comply with the National Law 133, which is a person must not advertise a regulated health service or business that provides a regulated health service in a way that is false, misleading, or deceptive, or is likely to be misleading or deceptive. And that's where people get caught up. So the other point of reluctance is about being too busy or not. So needing more phone calls from people that can't be catered for. What are your thoughts on whether a website is important for those health clinics?
Yeah, so this goes back to my point before about making sure that the website's done correctly. So when it's not done well, and this is true of any industry, not just health, but the result will be a lot more unpaid work. So you will get more inquiries, more phone calls, more emails, and none of those will be the right people. And so you're ending up with a lot more unpaid work. But when it's done correctly, you'll get more of the right people calling. And that's really where the gold is. So that's one aspect of doing the website correctly. It's about getting the right patients. But the other aspect is around the business or the clinic itself. So again, just if we focus on the website for a second, it could be that the website encourages more people to send an inquiry if it's not an urgent matter, rather than actually just providing phone numbers everywhere. Just click a phone number. So that means that you will then have your staff be able to answer non-urgent questions during their downtime, and not when you've got 10 people already lined up and on waiting for the phone calls because it's lunchtime. Everyone takes their lunchtime at the same time, and everyone is going to call the doctors at the same time. So it's about getting the right messaging on the website.
Yeah, and I mean, the receptionists are absolutely smashed, and they're golden in these busy practices. Managing calls, highly emotive, scared patients, and at the same time is a really stressful job, and certainly impacts how you present your clinic for the patients walking in. They don't want you to be on the phone either. So to reduce the calls coming through is better for the patient engagement, team morale, and you get more work done.
Yeah, and I'm guessing about 99% of clinics are already using text messages, which was unheard of 10 years ago. So,
definitely. And I mean, it's been shown to decrease the no-show rates, which is better for the business and the community. So, you know, I know everyone who works in health clinics puts other people first. That's
Mhm.
normally why they work there. So how does a digital presence do that or build on that?
Yeah, so the key here is to make sure that it's seamless. I know this webinar is called Can You Survive Without Digital in the Health Space? But I really think it should be, can you survive without embracing it? So health clinics do the human side really well. You know, there's no doubt about that. Without doing the same in the digital space, you're creating a bit of a crack and a divider, and that's the bit that is really going to hurt. So you just need to know as a patient that you're dealing with the same people, regardless of how you're dealing with them. So by that, I mean with the clinic and the people within the clinic. So for instance, if you're talking to the receptionist and they're beautiful, they're lovely and helpful and very kind, that puts you at rest and you're feeling good about your appointment. But then the day before your appointment, you get an SMS and it's all written in caps. And then it's got a few spelling mistakes and it might have the wrong year on the date of your appointment. And as a patient, the day before your appointment, that will start ringing out alarm bells. And all of a sudden, this great journey that you've been on so far, where you're feeling comfortable and you're not looking forward to the appointment, but you're relaxed about it, is completely reversed. And you're feeling stressful, and it's just, what this is like. It just kind of accumulates on itself. So I know that these are kind of extreme examples, but all the touch points need to be the same. It doesn't matter if it's digital or real. It's just our world, and it's the client journey, patient journey.
Absolutely. And I think to sneak one more point in there, you know, having the business goals that can be addressed on a well-crafted website and people get the feel of what the business is like, and you can be seen as a professional business and an employee of choice. And personally, I've had this previously when I've interviewed people that they've looked at our website and they said, well, I align with your values, so I do want to come and work with you. And isn't that great?
Yeah, so my parting thought on this, and I'll just share a screen just quickly. Okay, so this is my sales and marketing wheel, and I absolutely love this diagram. And what this depicts is the sales and marketing points on anyone's journey. And I've only put a few points on there. It doesn't really matter how many you have, as long as you've thought about each one and see which ones are relevant. But when you have a wheel, you need every point to be at the same level. So you can see here that full line, not the dotted line, is very skewed towards the hospital and the clinician, the network. And if you can imagine that as a wheel, if you're trying to get that to turn, it's going to go a little way and then it's going to get stuck, and then it's going to take a lot of effort to get over that hump, and then it's going to do the same thing again. So the idea is that you have a think about all of these different elements and you start to even them out a little bit. And that's where I've got the dotted line. And so it doesn't have to always be absolutely perfect, every point on the same one, but have a look at the ones that are lacking and try and push them out a little bit so that your wheel starts to resemble something that will turn around. You'll still need to push it at different points, but it will start to be a lot easier, and it'll take less effort to bring it to the next level. And then that's when you can see both your network, your referrals, and your business flourish. Regardless of whether you're in health or not, that's all what we're in it for, really. We want to enjoy our time doing it, and you do that much more if you're not pushing the rock up the hill.
Oh, absolutely. And I love this wheel because it shows you where to maybe focus first.
Absolutely.
And where you might not want to focus. And you don't need to do that part, but it shows you areas you should. If digital presence is improved, the outcome will mean more patients treated locally. More demand means more variety of specialties over time, and consistency of great doctors and facilities to serve the community. So it's a real win-win, I think.
Yeah, absolutely. And I think that understanding, you were saying before about the reluctance is around not fully understanding what the guidelines are. and just being scared and then therefore retreating. I think that is the scariest thing about this, because there will be people who embrace it, and you'll watch them. It's like holding, the horses back in the stable while half of them can take off.
Absolutely. And I think before COVID, that was okay. But now COVID has changed this landscape dramatically with health. And I think that's really important for us to have a look at. So we've got some questions that have come in.
Okay.
So let's have a quick look at this one. So should we add an Instagram feed on our website?
All right. So maybe should I answer that quickly from the technical point of view, and then you might have something else to say about that. I'm pretty strongly against this on any website. I feel that people don't go on your website to look at your Instagram feed. Yeah, they will follow you on Instagram. From a technical point of view, Instagram changed the way that they show the information. So we use plugins in the back end, and they break all the time. It's also really, really slow. And we talk about a 3-second budget. So you've got 3 seconds for your website to load up before people go somewhere else.
Wow, that Instagram feed would be over by then.
Yeah, 100%. And I'd much rather use that 3-second budget for something that's really useful, and not Instagram, which I think very few people will go, oh, look, Instagram feed, I'm going to go with this doctor.
Yeah, absolutely. And I guess on a regulatory perspective, Instagram feeds on your website is actually a form of advertising. So depending on what somebody's put on your Instagram feed, you have to be on top of it all the time, because if it's not correct, or if it's linking an outcome to a treatment, then you are really at risk of getting in trouble with the AHPRA guidelines. So I would suggest absolutely not on a regulatory space putting a feed.
Yeah, and
that's
not
a good option.
That's the great thing about a website, as well, as opposed to the other platforms, social media, whatnot, because you're always in control of that. Some people want to open up comments on their blogs or their news, but you can absolutely turn it off so that no one can comment on it. You put the referrals or the testimonials that you want, that you're comfortable with. No one else can touch it.
Yeah. Fantastic. And I guess the other one is the other question I have is, how many pages does a website need? Does it need to be big, or what does it need to be?
Yeah, it doesn't need to be big. I mean, that is the other part of making sure that you do it right. I think understanding the business goals is the most important thing. And so when people come to us and say, I want a website, you're the expert, you do it. It's like, well, no, we need to understand your business, and you're the only person who understands the business. So it's how long is a piece of string, really, but it doesn't have to be big and convoluted. It needs to say what you do and give people enough information. It shouldn't be an encyclopedia of your business either. Yeah. There's a stat that says 80% of people only read headlines on a website.
Right.
So yes, you need a little bit more information than that, because Google will read everything, and therefore you give a lot of information to Google so that it knows when to answer people with your website. But yeah, you want enough information on there for people to pick up the phone or send in that inquiry or ask more questions. But you don't want to give them, like I said before, an encyclopedia with all of the answers. So typically a 4 or 5 page website will be absolutely fine. If you have specialties, and if you've got more doctors, or you have different focuses, then you might need a few more pages. Yeah, so I mean, I know everyone is going to have lots of questions. More than happy for anyone to connect with myself on LinkedIn. I know you'll be happy for that as well.
Absolutely.
This is not something that you can learn about in a book or in 20-minute webinar. So yeah, more than happy for people to connect.
That's great. And I mean, as Letitia was saying, we've really just scratched the surface today, but stay tuned for our next webinars. We'll deep we'll do a deep dive even deeper into each component of building a strong digital presence. So next week we'll be talking about local search and SEO